Oh, right. I'm trying to make this like a conversation, and I think over time it will be that way. Okay, I'm kind of going to announce what is fentanyl. This is kind of going to help me throughout to separate kind of the questions, especially when it comes to editing and breaking everything up.
Okay.
So what is fentanyl? How would you explain fentanyl to someone who's never heard of it?
So I would describe fentanyl, there's two different types. So there is the prescription fentanyl, which you often will receive at the hospital after surgery to help cope with pain. And then, of course, what we're seeing in the public that is causing the overdoses is illicitly manufactured fentanyl, which is much stronger. Obviously, it is not FDA controlled, and that is what ultimately is causing the opioid epidemic currently.
And then what makes fentanyl different from other drugs, and how has it developed like over time? Because it's been around for a while now.
Correct, yes. So what makes fentanyl different are a couple factors. One is its potency. So regular fentanyl is 100 times more potent than morphine and 50 times more potent than heroin. And the other thing is, at its peak, fentanyl's cost was extremely cheap. It was about $1 a pill. And so that ultimately affected the demand.
And then what happens to like the body and the brain when someone takes fentanyl?
I forgot to answer how it evolved over time.
No, you're okay.
Okay, so should we go to
Yeah, we can go that route.
Okay, so how fentanyl has evolved and opioids have evolved over time is in 2002, we primarily were dealing with heroin. And back then we were dealing with about 23,000 overdose deaths across the United States. And that came as a result of more surgeries were happening, and then physicians were prescribing opioids on a more regular basis and weren't being very strict about it, and that led to the prescription pill crisis. And then as the legislative laws were passing that were reducing and restricting physicians writing those prescriptions, they turned to illicit fentanyl. And that's when they went to the streets to look for their opioids. And the potency and the contamination is ultimately what led to this increase in overdose deaths. So we started seeing it in 2015, primarily from 2015 to 2024. Fentanyl was in pill form. In 2024, there was a big shift to a powder preference. We also are seeing a shift from straight fentanyl to something they call power. What is the phrase? Let me think about this. Something balling. Speed balling. So they went to speed balling. And speed balling is where they use a depressant first, and something like methamphetamines, and then they'll take fentanyl. Then we're also seeing fentanyl laced with tranquilizers. So we saw the introduction of xylazine in 2024, which is a horse tranquilizer. And as recent as May of this year, Yakima County has confirmed cases of carfentanil, which is 100 times more potent than regular fentanyl. So it is 10,000 times more potent than morphine, and it's elephant tranquilizer, basically.
Yeah, and I feel like, at least from the coroner's perspective, he said as of at least this year, around this time, fentanyl overdoses are on the lower end. They're still, of course, prevalent in the county, but it's on the lower end. And even with kind of carfentanil taking like the stage, he was mentioning over the summer that he's probably going to see those spikes in overdoses just because people are out of school, there's concerts going on, people are taking vacations. It's just easier to access, especially during the summer months. So what happens to the body and the brain when someone takes fentanyl?
So the brain has something called opioid receptors in it, and the best way to describe it is when you take fentanyl, you get a high and you get a reward. Your brain releases a reward system. It releases dopamine in your brain. So similarly, when you eat food or you take a sip of water because you're hungry or because you're thirsty, your brain releases dopamine. So we all naturally develop a hierarchy of needs, and that's where people lack an understanding that this truly is a brain disorder, because what happens with fentanyl is fentanyl kind of parks itself in those opioid receptors, and it takes over your hierarchy of needs. So your body and your brain say, this is my number one need. It overtakes food, it overtakes hydration, in your brain as what you need to survive. So your survival instincts in your hierarchy of needs says, I need fentanyl or I'm going to die. And ultimately what happens is you see people that suddenly lose massive amount of weight. They're very dehydrated because again, as soon as they deal with or they feed that desire for another hit of fentanyl, they don't need to eat, they don't need to drink because they have told the brain it's okay now, you have your fentanyl. So that's where MOUD, medication for opioid use disorder, is so critical to the recovery of individuals struggling with opioid use disorder, because things like Suboxone or buprenorphine actually will bump out the fentanyl in the opioid receptors and they replace it. And so it helps with horrific withdrawal symptoms. So people that experience withdrawals feel like they're going to die. They're vomiting. They want nothing other than fentanyl. And so what happens when you have Suboxone and buprenorphine is it replaces fentanyl in those opioid receptors, helps with those withdrawal symptoms, and ultimately it reduces the cravings for fentanyl. And so I firmly believe, and there's science and evidence to prove, that communities that fully support medication for opioid use disorder, increasing the number of prescribers that issue it, increasing mobile units out, giving it to those struggling with opioid use disorder, actually see a massive lapse in the number of deaths, and these people can achieve long-term sobriety and live truly functional lives.
And would you say it really only takes, what's the kind of word for it, one hit for it to kind of park itself in your brain and say, this is what we need?
100%. That's the evidence shows that people ultimately think, well, I'm going to try it. They play Russian roulette, and the potency and the reward in the brain is so strong that ultimately you become addicted to that substance after one hit.
Wow. And I guess you kind of already answered it, why it's so deadly even in small amounts, because it just takes that one time. Oh, I'm just going to try it, and then I'll be fine afterwards. But like you said, it kind of sits there, and then it's so strong, you don't want food, you don't want water, you want that.
Correct. So what happens when you take fentanyl is a lot of people think that it is a stimulant, and it's not. It's a depressant. And so ultimately your body and your, what's the word I'm looking for? Let me find it in here. Your respiratory system. Thank you. That's what I was thinking of. So what happens when somebody takes fentanyl is it's a depressant, and so your respiratory system slows way down. Your breathing slows way down. And when someone overdoses, what ultimately happens is your respiratory system shuts down. And to give you an idea on the potency of fentanyl, if you take a sweet and low packet that's full of sweet and low, if that was replaced, that powder in the sweet and low packet was replaced with fentanyl powder, it would kill 500 people. So it only takes the equivalent of 2 to 3 granules of salt. That equivalent of fentanyl can kill a person. Now, obviously, somebody that uses regularly builds up a tolerance. And that's how they increase over time how much they're using. But again, it's Russian roulette, and especially when they're using contaminated fentanyl, they may not know that it's laced with carfentanil, and they think it's their regular potency, and they ultimately end up succumbing to an overdose because they have no idea what they just put in their body. And
then, like you said, it's cheap, so they don't know what they're getting, they just know it has fentanyl, or it is fentanyl. And how would you describe kind of like the fentanyl crisis in Yakima right now? I don't want to kind of use the terms bad or good, but how would you describe it?
Well, I would say that it is in a crisis situation. We are #1 in the state for overdose deaths per 100,000. Give you perspective, in 2002, our overdose rate per 100,000 was 3.37 when it was the heroin epidemic. Today, it's at 59.6 per 100,000 in Yakima County. So we are #1 in Yakima County for overdose deaths per 100,000 in the entire state of Washington.
Wow. And where are you seeing fentanyl most? I know you mentioned the last time we talked, there's kind of a mix between adults, teens. Teens are kind of only being kind of quote unquote attracted to it from both schools and kind of on the parent side of things. Not to blame the parents, but talk to me a little bit more about that, because we discussed it last time.
So actually, we're not seeing a large youth usage of fentanyl. Addiction starts, and this is where there's a huge misunderstanding. Youth have a perception that fentanyl is low risk. Of course, we all know otherwise. Thankfully, when you look at the overdose statistics, overwhelmingly the people that are dying of fentanyl overdoses are ages 25 to age 60. Again, addiction is an adolescent disease, and what I mean by that is youth that, let me rephrase that, it's an adolescent disease, so those that struggle with substance use disorder as an adult will tell you they started using as a teen with alcohol, tobacco, or marijuana. They're not using fentanyl. In fact, we have very few deaths. I believe the youngest we've seen in Yakima County is 15 years old. Thankfully, we don't see a lot of them. One is still too many, obviously, but we're not seeing it in large numbers in the schools. However, our concern is we still see that alcohol is the #1 substance of choice for youth. We are also seeing higher potency products, so higher alcohol content. THC levels back in the early 80s were as low as 4%. We're seeing them as high as 98%, which causes cannabis-induced psychosis in youth. We also see that there is a huge disconnect between parents and youth. And what I mean by that is the healthy youth surveys that youth take in Washington State every 2 years indicate youth say, yeah, my parents don't talk to me about substances. And if they do it once and then they stop talking about it. With today's youth, you need to start having the conversations at age 7 and continue them frequently until they're done with college. So they need to be short and frequent conversations about the risks of substances and the parents' strong disapproval of substances. Parents remain, and if it's not a parent caregiver, evidence shows that parents and caregivers remain the #1 protective factor in a youth's life. So preventionists are all for shutting down the border and cutting down the supply of fentanyl because obviously the overdose deaths we're seeing at young adults and into adulthood. However, it does not address the demand side, which starts as a youth. So if somebody uses alcohol, tobacco, or marijuana at or before age 14, they have a 34% chance of developing a long-term substance use disorder. If through prevention efforts, parents having frequent conversations with kids, schools bringing in prevention curriculum to build resiliency skills and drug resistance skills, and community members coming together to educate youth on the risks and strong disapproval as a community of youth using substances, if together we can delay that initial substance use from age 14 to 15, their risk of developing a long-term substance use disorder reduces from 34% to 29%. If we can kick the can down the road another year to age 16, it reduces another 5%. If we, through prevention efforts, can delay that first sip of alcohol, that first puff of a cigarette, that first edible to age 18, even though the youth may experiment with alcohol or use when they go to the college or as an 18 or 19-year-old, they have almost 0% chance of developing a long-term substance use disorder, which means there will be no demand for fentanyl. And what would you say to those, because you mentioned that most adults who are on those substances, whether it's fentanyl, whether it's alcohol, whether it's marijuana, edibles, most of them kind of experience the start of it in their teens. So what would you say to those parents who almost don't want to be critical of their children because they got to experience it in their younger years, same age as their children? Absolutely. We get this question a lot. Well, what if I used? Well, first of all, our parents didn't have the knowledge and the statistics that we have today about the risks of those substances on the developing youth brain. So prevention is not anti-alcohol, anti-marijuana, anti-tobacco. we are anti-alcohol, anti-marijuana, anti-tobacco for youth. That's what it's about, because that brain is so critical in those early years. And so first and foremost, even if you used as a parent, you're not being hypocritical. You could just say, Grandma and Grandpa didn't know the risks. We didn't have the information we have today. Second, substances were far less potent back then. Again, I go back to the alcohol content. It wasn't as readily available. Remember, we privatized alcohol in the state of Washington in 2012, so they can get it anywhere. Then there was something called the internet that came out, and so people can have those things delivered to their house, and all they have to do is say they're 18 years old in many cases. They can purchase vape and have them delivered to their doorstep. That didn't happen when we were growing up, so the availability is also an issue. The internet and social media, so kids can meet someone in a parking lot and purchase it out of the trunk of a car. And so again, parents having those short and frequent conversations about, yes, I used, however, Grandma and Grandpa didn't have the information today. The potency and the risk of the product we used as a youth was much less. Marijuana THC levels, again, were 4%. Today, they're upwards of 98%. And even dispensaries will tell you they don't like the high potency items either. We have that in common because they understand the risk to the youth developing brain. And so really it's about the youth use is critical to the prevention efforts, and having those short and frequent conversations. It's not a matter of, oh, my child's a 7th grader, I had the conversation once, I checked the box, we're good to go. The Healthy Youth Survey data also indicates that parents and siblings are primarily providing the youth with their alcohol, tobacco, and marijuana, which tells me there is a huge misunderstanding, a huge disconnect among them, and understanding that they believe it's a rite of passage, but they're not understanding the negative effects to the development of that youth brain, and that they're not understanding the difference between the substance they grew up on versus today, and just taking a firm stance to say, okay, I need to, as a parent, step up, have these conversations more frequently, and also to make sure that I'm not hosting parties that show that it's okay as a rite of passage for youth. I'm going to show my strong disapproval.
And even to add to that, I feel like a lot of, like that rite of passage, like you said, I feel like a lot of parents will kind of had that ideology of, well, let me start with you doing it at home. It's safer at home for you to do it at home. But it's kind of like that still is that negative connotation to doing alcohol, drugs, and other things, which later in life could lead to other things.
Absolutely. And I think, again, with parenting skills, they evolve over time, right? So my parents were very much of that mentality that, okay, you can use, but you have to be at home. I grew up with that. And my parents were European descent, too. And of course, you can drink at a younger age in European descent. If my parents had the information that I have as a mother today, there is no way they would have allowed that to happen. And so I really, truly want to sincerely believe that it's just lack of knowledge, that parents just don't understand that being casual about it or allowing it, saying it's just a rite of passage, how that potentially could lead to that child becoming addicted to fentanyl. And if they're really honest with themselves, if they really say, yeah, I am a little too relaxed about this, I need to have these conversations more frequently and make sure my child understands, because they're the trusted adult. The youth is going to understand those risks more than anything coming from their trusted adult, their parent or their caregiver, whoever is their primary caregiver.
Oh yeah, because they're your first teachers.
Yes.
In life. So we've already discussed the youngest case that you've come across in Yakima. Are you seeing more overdoses? Are you seeing more overdoses to the point where you take Narcan, you're I want to say back, you're not dead. Are you seeing more overdoses, or are you seeing more deaths? Overdoses like with Narcan, you're all settled, you're all good, or more deaths?
This is a great question because one of the things in Yakima County, Safe Yakima took the lead on what we call an OD map project. So overdose mapping is relatively new software. I went to a conference and learned about it, and one of the things I learned when I took over as the executive director at Safe Yakima, it was rather shocking to me, is I reached out to the coroner's office in 2022 and said, hey, I realize in 2021 we had X number of deaths, overdose deaths. How many people survived an overdose, a substance use overdose? We don't know, we don't measure that. So I called the local hospital and I said, of all the people you treated for overdose, how many people survived? We don't track that. So then I called the King County Medical Examiner's office and said, is there some state level data that we can have access to so I know the true magnitude of the problem we're dealing with? We don't measure that. And shortly after that, I went to a conference and there was a booth there with a product called ODMAP. And ODMAP is an interface that law enforcement, first responders, and hospitals can link to their individual reporting dashboards. So when they enter an overdose into their computer, it will automatically map in near lifetime that if a person is a fatal or non-fatal overdose. And so I was like, we need this in Yakima. Well, in the interim, Yakima Fire Department, who by far responds to the lion's share of overdoses in Yakima County, manually tracked the number of overdoses they responded to in June, July, and August of 2023. They just manually checked. And the numbers were astonishing. They responded to 1,300 overdoses in one quarter, one agency. So if you take that figure and multiply it by 4, that's 5,200 overdoses, one agency in Yakima County. So we conservatively estimated another 800 overdoses for the rest of the county for Yakima Sheriff's Office, Sunnyside Fire, Toppenish Fire, Wapato Fire. Okay, let's estimate this is how many overdoses. So that's 6,000 overdoses in 2023 in Yakima County. We had 96 deaths. That means 5,904 lives were saved as a result of Narcan, and nobody knows it. Now, I used to be a believer that Narcan enabled people to continue use, and I became educated with those statistics because without Narcan, all those people would have died. And there's something we use in prevention called the continuum of care. And if you think about it, it's like a half sun, it's a semicircle. And at the left end of the spectrum is something called prevention, and it's universal prevention. And as you get to the 90-degree angle, there's something called harm reduction, and then there's treatment and recovery. There are 3 distinct, different ways of dealing with the opioid epidemic. A lot of people mesh them together, but they're 3 distinct measures. Narcan and medication for opioid use disorder are harm reduction. They are not any kind of treatment, if you will, recovery. We cannot treat a person who is deceased. We have to keep them alive, and we have to keep having the conversations that help is available. And if they get on medication for opioid use disorder to help with those strong withdrawal symptoms and to help with those cravings, and they can become sober for at least 30 days, because if you take an MRI of the brain of somebody who's struggling with alcohol disorder, doesn't matter the substance, it could be marijuana disorder, it could be an opioid use disorder. If you take an MRI of that person's brain, you will see that all that exists is dark matter. A person who doesn't have a substance use disorder, you will see there's highlights and there's light spots in their brain. So over time what happens is that gray matter replaces the white matter in the brain, and they lose their sense of wanting to eat, they lose their desire to eat, they get paranoid in their thoughts, their decisions become poor, they know what they're doing is wrong, but again, they're in survival mode. If a person goes 30 days without using substances, that light matter starts to return to the brain reconnects. And if they go 6 months, you will see that it is fully back and full in shape. Well, what do we do with treatment? Soon as somebody's at 28 days, insurance no longer covers and we kick them out on the streets. And so that's one of the solutions we've talked about, is we need to increase insurance coverage, because at the point when they're just now starting to function and make sound judgment, we're sending them back out on the streets. And what are they going to do? They're going to use again.
And then are you seeing more people kind of go through those steps, or are you seeing more people kind of, okay, I got my Narcan, send me back out on the street. I don't want to be here, I don't want to do this?
So it depends on the individual. So I have personally at Overdose Awareness Day, obviously there's a lot of people that have lost loved ones to an overdose, but there's also people that have achieved long-term sobriety there. And having conversations with them, you will find that it's different for everybody. Because why do youth begin using in the first place? Because they struggle with something called adverse childhood experiences. They had a divorce in the family. They had domestic violence at home. They had an incarcerated parent. They were neglected as a child. There's 10 different adverse childhood experiences, and the more that one individual experiences as a youth, the more likely they're going to turn to substances to cope as a youth. And so if we can offset in prevention work those risk factors with protective factors like resistance skills, assertiveness skills, resiliency skills, and we can also expose them to healthier choices. When you're feeling stressed and anxiety, go for a walk, eat healthy, get 8 hours sound sleep, reduce your screen time. Those are all protective factors. Have conversation with mom and dad. As we see that over time, it depends on the youth. So as they go through overdoses, if they have fewer adverse childhood experiences, it could take one overdose and they say, I'm ready to go to treatment. The most that I've spoken with is I spoke with somebody who it took 14 overdoses before they were ready for treatment. And so they have to understand that there is something out there that will help them cope with those withdrawal symptoms and those cravings. Because again, their brain is telling them they're going to die without that fentanyl hit. And so they need to feel that there is a solution. Microdosing buprenorphine and or Suboxone is the solution, but that takes many conversations and building of trust. And it also depends on their mental state at the time when we have those conversations. So when the comprehensives and the triumphs and the Barths, Union Gospel Missions, Camp Hopes are having conversations with people struggling with substance use disorder, and maybe they just revive them, they may not be in a mental state where they're ready to have that conversation yet. And so we need to have it frequently. And yes, we would all love to not have a need for Narcan and to not have a need to have the conversation over and over again. You will see that some people in treatment, first responders, become very jaded. Even parents become very jaded because it feels like a merry-go-round. And we just have to understand and be willing to take the time to learn, and then also be willing to accept alternative solutions like medication for opioid use disorder. There's a belief that it's just another drug for druggies. There's a belief that people can overdose on medication for opioid use disorder, and that's scientifically impossible. So there's false information out there about it. At Overdose Awareness Day, I had a person say, oh, I don't believe in buprenorphine. I had a friend who overdosed, they snorted it. And that was incorrect information. The most that it can your blood supply can obtain is 40% when they take Suboxone or buprenorphine. So that's the highest content that will elevate your blood level. In order to overdose, it has to be over 80%. So if somebody said, my friend overdosed because they snorted buprenorphine, it was not buprenorphine. They took something else that caused their overdose.
Something mixed.
Mm-hmm. Or they intentionally took something that Suboxone would not. It was a non-opioid drug they took that caused that overdose.
Now let's get into some stats. I think we might have already covered majority of them. Let's see. We already compared Yakima County to the rest of the states. Are there any statistics on first-time users that you have? And who kind of are they?
Which one is that one? Which question is that?
Stats and trends for?
I would probably also back up to the have you seen increase, because I want to talk about the fluctuations that we see.
Okay, yeah.
So if you want to frame that question up.
Have you seen overdose rates go up since last year? I know I mentioned to you that I talked to the coroner the other day, and he mentioned this time last year we are around 60s, 70s, and we're around 40s, 50s as of June of this year.
Correct. So it's a complex answer. So we do see these periods of time where we may see reductions, but they aren't necessarily sustained. And so an example, I go back to 2002 when our overdose deaths across the country were over 23,000 as a result of heroin. Our overdose deaths as a country peaked between August of 2022 and August of 2023. They were just over 114,000. And we started to see a steady decline as a country in the number of overdoses. However, in January of 2024 to January of 2025, we saw 1,400 more overdose deaths than we did the prior year. So we're starting to see, in a rolling 12-month average, a spike again. And we also typically, on the west coast of the United States of America, lag behind the East Coast. And the reason why is that there are over 116,000 chemical companies in China. China ships the ingredients for illicit fentanyl to the East Coast ports primarily. From the East Coast ports, they start to disseminate on the East Coast, and then they also send them north to Canada and south to Mexico. So you will see a spike in overdoses on the East Coast, and then as they lag, we suddenly see a spike on the West Coast. So we're always behind the trend because of the distribution chain. Of course, that is now being impacted because we're closing the southern border. So we have absolutely in Yakima County seen a substantial decline in fentanyl distribution. We've also seen the cost go up already. So we're seeing a shift right now back to methamphetamine and cocaine because, again, that's what's available.
And so I want to kind of jump off the reasoning. Do you think that there was such a kind of high count between 2022 and 2023 because of COVID? I know we're COVID was 2019, 2020-ish, and then as of 2022, this is only 2 or 3 years later. Do you think that COVID played a factor?
No question. People were isolated. We saw a spike in anxiety, depression, and people needed to cope, right? They were isolated at home. We saw an increased prevalence in domestic violence. And so as a result of that, the mental health crisis started to burst. The good news is we started to recognize that, and we started to reduce the stigma about depression and anxiety and asking for help. So we had athletes like Michael Phelps, Simone Biles, Serena Williams come out and say, I felt depression and I needed to get help. I reached out for help. And then as data started to come out and people got educated that over 90% of people had expressed they had felt depression one or more times in their life, people realized it was more common than they thought. And then we started really promoting as a society, it's okay to ask for help. It's actually welcomed and encouraged now, and there's no stigma associated with it, or reduced stigma, I should say. We're also promoting healthier alternatives. Let's go for a walk. Let's pick up the phone and call our friend. Let's cook. Let's read. Let's watch a movie. Let's do something. Put your phone down and get off the screen time because there's so much misinformation on there. And I think that ultimately is why we saw a spike. But the good news is we recognize that and we're now promoting healthier alternatives.
And I think it's even better because we all experienced COVID together. It's not just the West Coast was on lockdown or just the East Coast. We all were on lockdown. And then there was kind of that spike in mental health, and a lot of people went to go get help. A lot of people even got emotional support animals. That became a thing. So it kind of all came full circle. And even though those cases kind of went up, it's true to your point of it was kind of a good thing.
Yes, right. Mm-hmm.
Okay, I think
and then you were on the statistic of first-time users.
We're doing good. We're doing good. No, because you mentioned, when I asked you, are there any statistics on first-time users, you mentioned no.
There is not.
Okay.
That is something that is not measured. It's an unknown element. Right. Again, we don't even have an accurate depiction of the total magnitude of the problem, right? So in Yakima County, we linked my project with ODMAP we linked all law enforcement, which are on a dashboard called Spillman, and then firefighters are on a different dashboard. They're on something called Image Trend, and we discovered that it's $5,000 a year to connect their reporting system to ODMAP per agency. Well, there's a lot of fire departments in Yakima County, and that was a big ticket item. So we Safe Yakima met with the fire chiefs and said, who absolutely cannot afford to enter their responding to overdoses twice? Who can't afford to enter the data twice? And we identified Yakima Fire Department for obvious reasons. They're the largest that respond to the most. Toppenish Fire Department, Wapato Fire Department, and Sunnyside Fire Department. Well, through our opioid settlement dollars, so thank you Yakima County Commissioners for approving that and putting them to the wise use, they are paying the $5,000 per year to pay for supporting the interface that links image trend to ODMAP, so when firefighters respond from those 4 agencies to an overdose, they enter it in their dashboard in near live time data, it populates. So we will now in Yakima County be able to track a large majority. It's not 100% perfect because there's still overdoses at home that people may not report, but we will get a better idea on the magnitude of the problem. Going back to those 2023 statistics, when you look at, we had approximately 6,000 overdoses and only 96 deaths. We were underestimating the magnitude of the problem by 6,200%. In the state of Washington, that same year, so from April of 2023 to April of 2024, we had 3,464 overdose deaths in the state of Washington. If you take that 6,200% multiplier, we would have had over 218,000 overdose deaths, and nobody knows that because we don't have ODMAP. We're not tracking, we're not measuring non-fatal overdoses. So overwhelmingly, people are surviving them because of Narcan, and sadly because our first responders are getting so good at reviving them. But yet, we're throwing money at a problem and we're only measuring the deaths. So you can see why the problem still exists. We haven't even stopped to take the time and invest in the resources to get an accurate number on the magnitude of the problem. Then we can go in and fix it. Now we truly know as a state, as a county, as a city, what is the true magnitude of the problem so we can throw resources now effectively at it. Right now it's just like throwing mud at a wall to see if it sticks. So that's the benefit of having ODMAP. Yakima County, as a result of Safe Yakima taking lead and working with law enforcement and first responders, meaning the top 4 fire departments, we got 70% of our agencies linked to ODMAP, which is #1 in the state that is linked to ODMAP. And what happens is now when we experience 5 or more overdoses that could be fatal and non-fatal in the county, you'll see something that'll come out that says it's a spike alert. And that is so that we can get all hands on deck, get peer navigators out on the streets to high-risk communities. We can actually look at a heat map and see where these spikes are occurring so that we can get out and talk to people about getting them fentanyl strips, using Narcan, never using alone, because people still believe that if they overdose, they can self-administer Narcan, and that's impossible because, again, your respiratory system is shutting down. You cannot give yourself Narcan if you are overdosing from an opioid. And so it's important that they have those resources, not because we're enabling them, because we need to keep them alive until we can get them on medication for opioid use disorder so that they can get their brain back to where it's at a functioning level where they have the lights back in the brain and they can go to treatment and effectively participate in treatment. And so we're very excited at Yakima County that we are actually leading the state. HIDTA, High Intensity Drug Trafficking Area, is a national organization. We are leading the state in terms of how we're addressing these overdose spikes. So Safe Yakima sends out spike alerts. We tag agencies who their target market is these high-risk populations, so Comprehensive, Triumph, the hospitals, so that they have an awareness and they get it out to their target populations to say, hey, there's either a high-potency product out there or there's a contaminated product and we're seeing a spike in overdoses. Something bad is happening. It also allows us to alert our partners in adjacent counties. So when we get those spike alerts, Safe Yakima Valley reaches out to Benton County, Franklin County, Grant County, and alerts them that, hey, we're seeing this substance, and history shows that once it shows up in Yakima, it's headed their way. So they can notify and warn their hospitals, and they can get boots on the ground to warn people and get fentanyl test strips, Narcan, never use alone cards out to these people to keep them alive until we can get them on medication for opioid use disorder and treatment.
No, that sounds great.
Yeah, I mean, we're very excited about it. It's baby steps. It's taken a lot of time. This project took over a year. It was about 1.5 years to get it. But we're very excited to be, all eyes are on Yakima County to see how we respond with ODMAP.
And I mean, it makes sense. Why just document the deaths? Because then you're, like you said, you're not looking at the full picture.
Right.
And then of course, people have had multiple overdoses before and haven't died. They need to be a statistic as well. As sad as it sounds, they need to be a statistic as well.
Correct, right. And part of that is educating the community that Narcan is not enabling any behaviors. We have to keep them alive. We cannot treat a dead person. And so we have to continue to have those conversations about medication for opioid use disorder. Treatment works, having those conversations. Now, without MOUD, there's a 90% failure rate in treatment, so the average person has to go back 7 times in order to achieve long-term sobriety. But if a person is on a medication for opioid use disorder, so Suboxone or buprenorphine, they're 14 times more likely to achieve long-term sobriety, which is 6 months or longer. So that's why medication for opioid use disorder is so critical to a solution for a long-term solution for long-term sobriety and reducing deaths.
What are we on next? Comparison to other drug crises. So what happened to the crack cocaine epidemic? I feel like a lot of people don't talk about that as much anymore, and they're kind of just focus on fentanyl, focus on meth, focus on a little bit on cocaine, less than, I feel like meth's a little more popular lately than cocaine.
Yes, it is. The statistics would show meth is meth and cocaine mixed with fentanyl are primarily what's driving the overdoses. What happened, obviously, the crack cocaine epidemic was the 80s and 90s, and we had something called the war on drugs. That was very effective. We had harsher laws, so if somebody was caught with crack cocaine, the laws were harsher. And so we, of course, know we can't arrest our way out of it, but they're effective. We still need that tool. Prevention work was much more effective. So people in the community were much more willing to get involved and help spread the word about the risks. Today, we don't see people. People talk and they complain about the problem, but we see fewer and fewer people volunteering on coalitions, volunteering at schools. We see a lot of unions that are so strong we can't get school officials to volunteer. Not all of them, but a majority of them, whereas that was not the case in the 80s. And prevention is about community effort and people coming together, and so that was huge in the 80s and 90s. Obviously, then what started to happen is new substances were starting to come in. Heroin was becoming more popular, and so it no longer became profitable. And the other thing is, you have to realize fewer people were struggling with mental health challenges back then. And we didn't have something called the internet or social media. And we can't underscore enough the damages that too much FaceTime, gaming, being on phones, on iPads, sitting in front of a TV all day long. A person is not getting connection, emotional and social connection with another individual through a device. And we had that back in the 80s, that physical connection, and people were going out together. Kids were playing on the streets. We're seeing a much reduced number of that occurring today, and that's why I think that this is occurring and the numbers are so devastating compared to what we saw in the 80s and 90s.
Internet has ruined us, sadly.
Yes, it has.
Let's jump to question 3, because I feel like you already kind of covered question 2. Does fentanyl carry more stigma or less than previous drugs, or even other current drugs now?
I would say yes, and again, it's attributed to, so stigma is often due to lack of education. And the epidemic I like to compare it to is the AIDS epidemic. So we, at our peak, lost the same number of individuals to the opioid epidemic as we did to the AIDS epidemic in the 80s. And of course, there was huge stigma, and people were called horrible names because of how people were perceived to have, what's the word I'd use? Perceived to have gotten AIDS, been infected with AIDS, how they were infected. And then the population became educated, and they realized you can't get it just from touching somebody. And people got it through blood transfusions, and people got it through needles. And what happened to the deaths? They went down significantly. What's the other thing that happened? medications became available. And taking those medications, in the beginning, there was huge stigma associated with it. Now, you see them advertised on television. And so I compare it to, that is the same as the fentanyl epidemic, but we're not there yet as a society. We lack the knowledge. There's an assumption that homeless people represent the majority of overdoses, and that is incorrect. The majority of overdose deaths, 55% in the state of Washington, are housed individuals. So this started because of an escalation in prescriptions. In the United States of America and in Canada, we have over 100 million surgeries a year. And what is prescribed every year with those? Opioids. And so if people don't know to stop taking opioids after 3 to 4 days or taper off, if we don't reduce access to opioids, if we don't educate the community not to share their prescription pills with each other, not to purchase prescription pills on the internet unless it's from a pharmaceutical company, it has to be a trusted source. If we don't spread that education, the stigma will still exist. And so we see it tremendously with fentanyl. Oh, it's unhoused people. It's the homeless population. They're the ones. It's people who don't have jobs. No, it actually could be grandma who lost count of her opioids and accidentally overdosed, or it could be a very successful executive who had shoulder surgery or oral surgery and became hooked on opioids because the pain was so great, and suddenly they have an addiction because the opioid receptors, those opioids parked in those opioid receptors, and now they have a substance use disorder, but they're not willing to get help because they fear judgment by society and their employer. And so the stigma is real. We've seen a massive reduction in stigma around Narcan. A year and a half ago, people said, no, we don't want Narcan vending machines. It's enabling, it's assisted suicide. And we would go to outreach events to try to educate and hand out Narcan, and we couldn't give it away. Now we go to an outreach event, and because of all of preventionists in the community and different organizations, different representatives in the community members that just became passionate about the cause because they lost a family member, educated the community. Now we go to an outreach event and we go through 50 Narcan in 15 minutes because people understand we can't treat a dead person. We need the Narcan to keep the person alive. And I firmly believe that is the hope with MOUD, for medication for opioid use disorder, that Suboxone and buprenorphine, people will gain a better understanding, they'll immerse themselves in the facts and the data, and they will go to the right sources to get the right information and not just assume what they read on someone's social media post is correct. And we will get educated as a community. But it starts with community, it starts with getting educated, and it starts by taking action. And I often say, don't complain about the problem unless you're willing to be part of the solution.
I love that. I wanted to add to when you're prescribed something, especially when it's after a surgery or something like that, at times there are those doctors or physicians that say, oh yeah, I'm going to give you 7 pills over the next 7 days. If you feel better after 2 to 3, you can stop taking them. But 2 to 3 days, you're feeling better, less likely for you to go sell your pill or give it to someone else, but it happens. Or you decide to take all 7 days worth and then tell your doctor, I'm still feeling some pain. And so it's so hard, it's not even hard, it's so easy for people to blame the homeless, especially in situations like that. Oh yeah, I'm still feeling the pain, and they're not feeling anything at all. They just loved the high of the pill.
Absolutely, yes, and that's why some of the solutions we talk about is remove yourself off of 3 days, ask for non-opioid pain solutions. So my husband had thumb surgery in December, and he got a nerve blocker, and he didn't need any opioids. So then when he started to recover, he was on Tylenol and ibuprofen. So there's alternatives out there, and recognizing that, okay, I'm going to stop after 3 days. A third of people after 45 days are still taking their opioids after surgery. And so again, this isn't just the unhoused population. Yes, that it is a problem for them as well. It's very concerning, but I want people to understand that the overwhelming majority still is housed individuals. And then what about those, again, that accidentally overdose? What about children who come into contact with those opioids? What about your pets? And the good news is with Narcan, it saves all those lives, and it's not risky to administer it. So a child can be given Narcan, a pregnant woman can be given Narcan, your dog can be given Narcan, and it will not harm them, but it can certainly save their life. And we actually proactively have reached out when retired Commissioner Ron Anderson was still alive. He lived in a retirement community, and he proactively was like, I want to distribute it throughout my community because we have accidental overdoses because it's a retirement community. The other thing is locking up your medications. So Safe Yakima Valley has free locking medication bags. So you can come and get medication locking bags for your marijuana and your prescription pills, lock them and keep them away from your children and from your animals. So there's steps people can take, and then once you're done taking those prescription pills and you know I'm done, having someone else count them. So when my husband, he was involved in a head-on collision a couple months ago, and he broke his sternum and had to have brain surgery. And so I administered his opioids. I kept count so he wouldn't miscount. And then as soon as we knew he was done with those, 3 days came and went, we transitioned him to Tylenol and ibuprofen. Then we immediately took them to a drug disposal box. So there are, on Safe Yakima Valley's website, we list all of the drug take-back boxes that are available in the community. They're no question asked. We don't care where you bring them. We also hold 2 drug take-back events in October and April. Again, you can bring a trunk load of medications. We're not going to ask you where they came from. We just want to get them off the streets. We also need to educate oftentimes among the elderly and among the Hispanic population. They have a tendency, a culture, to hoard their medications because they fear they may need them in the future, or they want to be helpful to a family member who maybe hurt their shoulder lifting something and they want to give it to them. And we really want to discourage that behavior. We don't want to share prescription medications because those were prescribed to that person based on their body mass index and based on what their procedure was. They actually could be contributing to the problem even though they're trying to be helpful. So again, it goes back to education.
And I think you kind of jumped into our next section of we can jump around.
Yes.
Prevention and awareness. You mentioned who's kind of affected. It could be your dog, it could be a baby, it could be the children in the house. As long as you have it in that medicine cabinet or it's out, they can just pop it.
Yes.
It's that easy. So what does kind of drug prevention look like in schools in Yakima County?
So, and I know that was somewhere. Which question is that?
That one is 2 on prevention and awareness.
Oh, okay, there we are. Okay.
Because we kind of already covered who's kind of affected.
Yep, okay. And we a little bit talked about gateways. So, in Yakima schools, I would say it depends on the school and it depends on the leadership in the school. So I wouldn't even say it varies by district. It varies by schools within the district. And so we can actually walk into a building and within minutes we know what the culture of that school is. And so some are extremely involved. Their leadership encourages their faculty to contribute, volunteer, recruit community members to get all hands on deck. They're very open to bringing prevention practices, again, evidence-based. It's critical that it's evidence-based and not that it is something that is not effective. And so we have relationships now with schools where they know that's all we do is evidence-based. We don't bring in anything that has not been proven by multiple agencies to be effective in reducing the number. And so it really depends on the leadership and the individual schools. It also depends, it really just takes one champion in a school. It could be a teacher, it could be a parent, it could be a parapro, it could be the principal. It just takes one champion to say yes, and it makes all the difference in the world because it's contagious. When people start to see that it's working and they start to see the numbers improve with their youth, it becomes very contagious, and suddenly you start to see more people willing and buying in.
And So is Narcan administered in schools?
So schools, sadly, again, given the crisis that we have, schools have Narcan. The school nurses have them. A lot of their emergency kits, they have them available. Thankfully, again, because fentanyl is not regularly used by youth, they haven't had to administer them. I don't know of any instances in schools. I know there's been suspected fentanyl cases, but they were disproven. So thankfully, they haven't had to use them, but nonetheless, the transportation departments, everybody has them. The athletic trainers have them, just in case.
Let me turn this off because we're going to hear it for the rest of the interview.
What is it?
Sorry, Eric. My camera's just going, and we don't need to hear that sound.
What is it?
It's my camera telling me that it's dying.
Oh.
Which is fine because I just wanted all of that as like an establishing shot.
Okay.
Sorry, Eric. He's going to be like, you were doing so great. I know.
And then you're like, sorry, I broke it.
Okay, hopefully you can still hear me. Okay.
Yeah.
Are there any programs that you can kind of talk to me about that you believe are working, both in the schools or just in general in Yakima County?
100% yes. So I will say there is, again, a stigma. People will often, my favorite question is, does prevention work? And I can say resoundingly yes, but it must be evidence-based. So a lot of people say, well, I was a DARE kid and DARE didn't work. And they're correct. There's been 8 independent studies that said DARE was ineffective. And the problem was, one, it wasn't designed to reduce substance use. DARE was created because in Los Angeles at the time there were a lot of arrests due to the crack cocaine epidemic and gang activities, and youth were very afraid of law enforcement because their first interaction with law enforcement was a bad situation. Mom or dad were getting incarcerated or some family member was being arrested. And so the thought was, how do we build positive relations with youth and let them know that overwhelmingly law enforcement are here to protect and to serve the people, and they're really trying to make communities safer. And so DARE came out, this curriculum, and so the police were like, okay, we're going to go to schools, and so we're going to have this interaction. But they were like, what are we going to talk about? Oh, well, let's talk about substances. Let's talk about drugs are bad. And the program was a success from the standpoint that it developed positive relations between the DARE officer and the kids in those schools. They loved their DARE officer. However, it did not move the dial when it came to substance use prevention. Again, it wasn't designed for that. The problem with the curriculum is it didn't teach skill sets. So what works in prevention is it has to be a curriculum that teaches how to grow skills. So resiliency skills, goal setting skills, drug resistance skills, and they must have an opportunity. The youth must be able to practice the skills. So there has to be time. So we have something called Botvin Life Skills Training that Safe Yakima administers in a lot of the schools here throughout Yakima County at the elementary, middle, and high school levels. And the lessons are 50 minutes each. The first 15 minutes, the students work in their workbook. The next 15 minutes, we have a conversation about the lesson, and the last part of the lesson is spent practicing the skills they just learned. The other thing that works is something called positive social norms. So if you were to ask adults and youth, what percentage of 8th graders do they believe, boys and girls, vaped in the last 30 days, they were overwhelmingly say 60, 70, 80%. The truth is, it's less than 10%, and that is in Yakima County and across the United States. So there's this huge misperception on the amount of youth using substances. But we don't say only 10% of youth use substances in Yakima County. We flip the narrative and we say the overwhelming majority, and we'll say the percentage, 93% of Washington middle schoolers haven't vaped in the last 30 days, and that's based on actual data. And so we bombard the youth with that message, because if you are a youth and you're in the bathroom and you say, hey, Alicia, you want to hit my vape? And I believe the overwhelming majority of my peers use, I'm more inclined to say, okay. But if I know through positive social norms campaigns that the overwhelming majority of my peers disapprove and don't use, I'm going to say, no, Anisa, thank you. And by the way, you shouldn't either. I'm going to be more likely to encourage you not to use because, again, the norm has been identified. So that works. Positive social norms campaigns are also effective. Citing consequences. You can't get college scholarships. You get kicked off your sports team. So when you cite consequences. And then if the message comes from parents or caregivers, again, this is not preventionist job or general community members' jobs. If preventionists or a trusted adult cites the risks and their strong disapproval of substance use, again, that is also effective. What is not effective, again, is DARE because it didn't teach skills. Fear tactics do not. Youth will tell you they think they work, but this is your brain on drugs or bringing the crash car onto the school scene doesn't work because it doesn't have enough dosage. They leave there and maybe for a day or two it affects them, but it doesn't build long-term efficacy. And that's what is important with prevention work. And I often compare it when people say, does prevention work? Overwhelmingly, yes, but I compare it to an iceberg. The work that you see the effects of are often submerged underwater, right? So what you see as the problem is the peak. But imagine the size of that iceberg if we didn't have prevention. We all want the number to be 0, right? We want to eliminate the need, just like we don't want to have a need for Narcan. But reality is the need exists because youth are constantly growing up and adverse childhood experiences exist. And so we have to, as community members, offset those adverse childhood experiences by making sure that we have pools for kids to go to in the summer so they're not being recruited by gangs. We need to have sports teams so that kids have something to do to keep them busy. We need to take them to arts and crafts. We need to spend time with our kids, take them to the park, go on walks, go on hikes, minimize the FaceTime so they're not getting exposed to violent messages and being lured by online perpetrators, which is also something that is underperceived occurring. So with drug trafficking, we also, and community members do not know this, we have a sex trafficking problem in Yakima County. We know of youth in our schools that are being used as being sex trafficked, and they're being used as drug mules in our own community. And there's a lack of awareness about it. And we have to, again, through prevention, expose parents to know what are the risks. And their youth can be targeted on Etsy, on Pinterest, on Google, on game apps, on Candy Crush. It doesn't matter the app. Their child can be targeted. And so we need to have those conversations and we need to do it regularly. And the parents need to show up and listen.
I hadn't heard Darren so long. I'm starting to feel older. My officer was officer friendly. He always came in every year. And then when they had the DARE summer camp, I was like, I have to sign up. And there was like thousands of applications and they only chose like 20 kids. And I got to go every summer after that. And as much as it didn't really do much, I enjoyed it in my summers.
Yeah.
And I think, it did help with that kind of fear of law enforcement or seeing law enforcement just being active, especially on the streets. Because you're like, oh, okay, that's just officer friendly.
Yeah, absolutely. Yes.
Yeah.
And DARE actually, believe it or not, they're revamping their curriculum and they're adding a skills set to it. Because they understand, again, that there was positives that came as a result.
I loved it.
Especially after the Defund the Police campaign, during the COVID epidemic, when we had people that were fearful of law enforcement. And so, again, there are bad apples, but the overwhelming majority of them are good. And so they want to bring DARE back to help people not be fearful of law enforcement. But again, they want to make it effective also. If they're going to talk about substance misuse, they want to build those skill sets. So it actually is being revamped for that very purpose.
That'd be great. I had a great time. We discussed that. So if you had 30 seconds to warn someone about fentanyl, what would you say? I kind of skipped over those other questions because I feel like we already covered it.
Okay, let's see.
I feel like we already kind of got there.
And number 7 is also one that probably we need to talk about.
Number 7. Yes. Okay, let's start there first.
Okay.
What resources do counselors and prevention officers here need more of?
Well, of course, I'm going to go with the obvious answer first, and that is more funding. What a lot of people don't realize is, as effective as prevention is, we only receive 3% of the federal funding pie. 97% goes to treatment and recovery. Now, remember, treatment and recovery, yes, it is effective. It would be more effective with MOUD, but it has a 90% failure rate. The cost of prevention per person is $263. So when you look at a cost stretching your taxpayer dollars, it has much more impact across populations. The cost per person for treatment and recovery is $6 to $7 million per person. So currently the opioid epidemic is costing our country $2 trillion. And again, without knowing the true magnitude of the problem, because we don't have ODMAP across the nation, dispersed in all the communities. We're throwing dollars at a problem, but we're also throwing the majority of the dollars at something that has been deemed ineffective and needs revamped. And I go back to, yes, we need treatment and recovery, 100%, but we also need prevention. So first and foremost, we need more funding on the prevention lines, because it is effective and it affects populations. So when you look at the continuum of care that we use, prevention is about population change. When you look at treatment and recovery, it's very individualized, as we talked about. People have different adverse childhood experiences. They have different traumas that led to their substance misuse, and they have to address those in different ways. Some people can recover after one treatment visit. The majority of them need to go back multiple times. We also need to, again, address the fact that that person's brain isn't fully working those first 28 days, and then we turn them loose on the streets. So that's also why treatment isn't fully effective. If they increase the amount of time somebody could spend there, while they are now able to fully participate in the treatment and recovery and talk about what those adverse childhood experiences did to them.
And get more of those lights.
Absolutely, they would be more effective. The second thing I would say we need more of is community involvement. So as we talked about, when you look at, and people can pull up, there is something called the Icelandic approach. And Iceland recognized that over 40% of their youth were using alcohol on a regular basis. They were binge drinking, and they were recognizing it was a big problem. And the community got involved, and it was an all hands on deck. And year over year now, they're averaging about 3 to 4% of youth.
It's not bad at all.
Yes, it has not become, and so they are making sure that kids have activities to participate in. They're volunteering on their coalitions and making sure that kids have organized activities. Their YMCA is highly involved. And so again, we don't see, when we put on an education seminar at Eisenhower or down in the lower valley, we will maybe see 25 to 100 people attend. When you think about the massive amount of money that we're investing in this and what a huge problem it is, you would expect that we'd pack those gymnasiums. But there's a denial factor. It's not happening to me. It's a rite of passage. There's also just a general attitude of lack of volunteerism. And so people can be on a coalition and invest as little as an hour a month and make such a significant difference. And we have a handful of coalitions in the community that they could volunteer. Safe Yakima has a mentoring program. They could volunteer as a mentor. They could volunteer at their schools. They could be trained in life skills training and be a facilitator, at schools to administer life skills training. They could put together and put all hands on deck to raise funding to have more camps, more sports events for those kids that can't afford to be in sports. So there's all sorts of things people can do. They're just not doing them.
And then I feel like even with the community involvement in the crack cocaine epidemic, war on drugs, there was so much community involvement back then. That's why it kind of worked. Nowadays, everyone's kind of in their own bubbles. The education's not there. Internet is taking over the world. AI is taking over the world. And it's just all coming down on us at the worst possible time.
Yeah, it's a perfect storm. And again, I can't underscore the significance that, you look at bullying and how that also can be an adverse childhood experience for somebody if they're bullied at school or bullied online. That's oftentimes where you see it. And so again, parents minimizing. I know it's convenient, it's a time saver to say, here's my iPad or here's my phone. But we have got to get back as a society to where we're putting limits on that, especially when we look at the sex trafficking trends, when we look at that people are reaching out to your children through those apps, and you can put on all the parental controls you want. What happens is they reach your youth through the gaming devices or those apps, and they build that trust, and then they end up going, they find out where you live, and they end up leaving a social or a phone or some sort of device that you no longer have parental controls on, and the youth hides it from their parents. The other thing, because we have 2 gangs in Yakima County, is we see with gangs always comes crime, comes drug trafficking, but also comes sex trafficking. And so again, as a rite of passage as being part of that gang, boys and girls get trafficked. The other thing, because of the lenient laws in Washington state, they know that if the youth are used as drug mules and are committing a lot of the crimes, that their punishment is going to be significantly less as a minor. So they're being groomed and utilized so that they don't go to jail and prison. And those kids that join gangs want a sense of belonging because they don't have a sense of belonging. So we as a community have to provide them something that makes them feel like they're part of something other than a gang.
And then, if you had 30 seconds to warn someone about fentanyl, what would you say?
You know, there's a lot of factors that would go into it. If they've used in the past or not, what is their age? You know, what would the messaging be, because it depends on the age, and what my relationship is with that person, what would be appropriate. Obviously, if it's a youth, I'm going to encourage them to have conversations with their parents and have their parents be the ones that deliver the message about their risks, the risks of substance use and their strong disapproval. In general, I would tell people that you know, there is illicit fentanyl out there, and it is deadly. It is lethal. It only takes once to take it, and you're hooked. I would educate them on the brain science, that once you take it, it takes over your hierarchy of needs, and it becomes the #1 thing that your body and your brain believe that it needs to survive. And talk about the potency and the effects of the potency. And really, you're playing a game of Russian roulette. The other thing I would discuss with them is, you know, raves are becoming increasing in popularity, and sometimes youth, college students in particular, they feel stress and anxiety around test time, and so they will go online and try to get Adderall, oxycodone, different things that they think they're purchasing online to help them get through that stressful situation. What they don't understand is when they're purchasing that online from an untrusted source, 7 out of those 10 pills they're purchasing online are fake pills. They're called fentanyls, and they're laced with a lethal amount of fentanyl, so they're deadly. And they're not intentionally laced, right. But when you're cutting fentanyl, you're not doing it in an FDA-controlled environment. These are labs that are in the jungle in a lot of cases, and they cut one drug and then they don't clean afterwards, they cut another drug, and so that Adderall could potentially be contaminated with those 2 or 3 grains of fentanyl that are now deadly. And so I would also tell youth, never take a prescription pill that has never been given to you. Or never been prescribed to you, excuse me. And even if it's from a family member, don't take it. It has to be prescribed by a doctor. And don't buy from an untrusted source. Make sure if you are purchasing online, it is a pharmaceutical organization online, and that it's a trusted pharmaceutical organization. So it would go back to the education piece.
Can you talk to me? Someone mentioned to me the other day when I mentioned that I was doing this series, they mentioned, oh, fentanyl or meth or cocaine, that's really only a thing that kind of happens in college. If you're at a party and you just accidentally get sticked, what would you say to that?
I would say that that is, again, misinformation. It's inaccurate. So what happens typically is it's not, fentanyl and opioids are not a youth epidemic. It's young adults, so 25 to 60 years old. And what has happened is that youth has used alcohol, tobacco, and marijuana to cope through their youth. As they get into their college years, they may say, oh, I'm going to take an Adderall because it's going to help with my anxiety for this exam, not realize they're taking fentanyl, and they become hooked or they die. And then as they get into young adulthood, their depression escalates because, again, now they've been taking the substances for several years. The alcohol is no longer effective, and they haven't dealt with the root cause. They haven't gotten help for those adverse childhood experiences and dealt with that root cause effectively through healthy choices, so that behavior escalates to stronger drugs such as fentanyl, methamphetamine, and cocaine.
I think what doesn't help either is that most of the shows, even if it's like Law and Order or Chicago PD, most of these shows are showing your kind of accessibility to drugs only can happen in college.
Right,
like that stigma.
Yep, nope, and that is also a contributing part of the problem. When you look at accessibility, you think about, again, during the crack cocaine epidemic in the 80s, 90s, in Washington State, alcohol wasn't privatized. You could only get it through a liquor store. You didn't have the internet. Now you can buy alcohol just about anywhere. You walk in a mini mart, they're right by the front door. They oftentimes position them right next to candy where the youth are able to, look at them and see them. A lot of mini marts will tell you youth will come in and steal them and run out the door, the buzz balls. So you look at accessibility. You can have alcohol delivered to your house. You can purchase it online. There is a drug trade online, so oftentimes Snapchat they use emojis as code to buy substances online.
It's a new one.
So somebody could go online, actually, as a parent, could look at something, it's called Emojis Decoded. They could Google it, and it's a sheet that tells them these are the emojis your youth are using when they are purchasing substances, and what does that look like. But again, it's really boils down to being a present parent or caregiver and having those short and frequent conversations starting at age 7, going through the college years, that are going to be your most effective strategy. You start to have those conversations as you're driving your child to the school. You're having those conversations when they get in sports. You maybe have a family member that struggled with substance use disorder, which was my case with my boys. I had 2 brothers that struggled with the substance use disorder, and so I'd always talk about, do you really believe that your uncles rolled out of bed one day and said, today I'm going to become addicted to methamphetamines? No, everyone thinks they can kick the habit. And of course, genetically, you don't know. And so they didn't choose that. Anybody that uses substances will say they didn't choose to become addicted. It happened. And so having that conversation with your child, again, I strongly disapprove of this. It is not okay. Your brain needs to be developed fully. Yes, I used as a youth. I wish my parents knew differently. I'm lucky that I didn't become addicted to substances. And more and more, I had the conversation so frequently with my kids that it just became, they would come home and say, so-and-so got caught today vaping, and so then we'd talk about that. My house was the house where all the boys in the neighborhood congregated, and I would say to them, okay, you want to hang out here, and then the same rules apply to you. And I remember driving them to the skate park, a group of them, and one of them talked about smoking cigarettes. This was before vaping was a thing. And I looked in my rearview mirror, and I said the boy's name, and I said, if I ever find out that you smoke a cigarette, I will take all those cigarettes and I will put them in your mouth and light them all at once. And he looked at one of the new kids who was in the group and in the neighborhood, and he goes, she would too. He is now 29 years old, that boy, and he brings it up to this day. He says, I remember that conversation. He goes, do you remember it? I said, like it was yesterday.
You put the fear of death in him.
And he knows
remembered.
He did.
But he remembered. Because at the time, even like the other boy who's making the joke, like, and she will, it stays in his brain.
Yeah, absolutely. And to them, they were at my house so much, I was a trusted adult.
Right.
Some of those boys to this day will text me Happy Mother's Day. They will reach out to me when they need help with their resume because they know that I would treat them like my own children.
Right.
Some of them, as growing up, struggle with substance use disorder, and they knew that I was a trusted source to help them and be by their side. I wasn't ever going to condone the behavior. I was going to get them the help they needed.
Or even judge them.
Yep.
I feel like that's a lot of people think that they're going to be judged if they open up or tell someone.
Absolutely.
Or the person that they're reaching out to is going to immediately judge them, immediately try to fix them.
Right, yes. And again, most people aren't experts in prevention.
Right.
So how do you become expert or more knowledgeable? Mm-hmm. You get educated, and you can Google it online, but you can come to the coalition meetings once a month and learn. You can attend these parent and education town halls that we do at the schools and throughout the community, and you can gain that information, and you'll be so much more effective as a parent and a community member in helping fight the epidemic.
And I don't know if it's so much of a fix. I'm helping you. But I feel like when it comes off as a fix, it kind of makes the person who is going through it shut down automatically and feel judged.
Right. Yeah. And stigma, right? I don't, my employer is going to fire me. And so educating employers on medication for opioid use disorder. So just because if they take a UA and Suboxone or buprenorphine shows up, does that mean they're using again? Not necessarily. And so confirming, do they have a prescription for this? Oh, they do. Okay, that's more likely. Are they still performing okay at work? Yes, they are. Or are they absent all the time? Are they making a lot of mistakes? So really judging it on their performance as opposed to a UA. But that could be easily verified with a prescription from a physician. Instead
of just outright firing them.
Yes.
All right, we're on section 5. What other synthetic drugs are on the horizon? We talked a little bit about carfentanil in the beginning, but what others do you believe are on the horizon?
There's no way to know. You know, we have already seen a reduction in supply in Yakima County of fentanyl, and in very short order, we saw carfentanil. You know, we had 31 overdoses in 1 week in Yakima County, and now spike alerts went out. Thankfully, the overwhelming majority of them survived those overdoses due to Narcan and first responders and their training. However, you know, 2 deaths is still too many. But when you look at, and of course now we're also seeing a shift back to meth and cocaine. They're always going to look at what is available, what is out there. And somebody's gonna, the cartels need to make a living. And so they're going to somehow manufacture something else and find a way, whether it's online, they're going to try and ship it, which again, that's the supply side. The most effective way to deal with, regardless of what the substance is in the future, is through prevention and recognizing this is an adolescent disease. 98% of people who use and struggle with substance use disorder, who have an addiction as a young adult or adult, started with tobacco, alcohol, and marijuana as a youth. And we have to go back to that. Why is that occurring? Because they grew up with adverse childhood experiences. They grew up in a household where they're feeling pain and they're feeling trauma and they need to cope with that. We as a society have to give them the tools how to effectively cope with that. And that's relationship building through mentoring programs. It is giving them skill sets. It's helping them understand that the overwhelming majority of their peers don't choose substances. They choose healthier alternatives, so they're more likely and more inclined to want to choose those healthier alternatives. And it's about parent involvement. You don't have to make a lot of money. It doesn't matter what your politics are, where you work, the color of your skin, what race you provide. You are the #1 protective factor for your child. Just get involved. And that doesn't take a lot of skills. Have the conversations. That doesn't take a lot of time. It could be 5 minutes once a week. And just making sure your child knows, I care about you, I love you, I want to see you be the most successful person you can be. Let's make sure we're choosing healthier alternatives. Yes, I know your other friend is choosing and getting a lot of FaceTime. However, let's bring them over here so I can help expose that child to more positive and protective factors. And again, if we get all hands on deck and we get parents that are more educated, we're going to see a dramatic drop in those overdoses.
I hope. Maybe we can go back to the 80s and 90s.
Yes.
Is it possible we haven't even hit the worst part of this crisis yet? Because I know you mentioned back in 2022 and 2023, that's when that kind of big spike happened. COVID was a factor of that. Was that the worst we've seen? Or do you expect something's going to develop itself?
100% it could get worse. And the reason I say that is the current administration, as I shared, we as preventionists 100% approve of closing the borders and helping reduce the supply of fentanyl, right? We know that closing the borders, that's 100%. We've seen that fact, that the supply of fentanyl has dramatically dropped off, costs have gone up. So we approve of let's reduce the supply. But what this administration is currently proposing is taking prevention dollars currently at $783 million $723 million and reducing them to $83 million.
Which is
We're only
drastic,
3% of the pie. We're going to be less than 1% of the pie, and we're not dealing with the demand side. They're wiping out a lot of mental health resources. They're wiping out a lot of the prevention resources. A lot of programs are shuttering and closing their doors because of this proposal. Hopefully, our Congress will understand that and approve a continuing resolution. But again, it goes back to even our legislators do not understand. Their aides are not experts in this. They do not understand the impacts of youth using substances as an adolescent. It is an adolescent disease. So there's a supply side and a demand side. Closing the borders is not going to affect the availability of alcohol, tobacco, or marijuana for youth in the United States of America. We have to address the demand side, which is the adverse childhood experiences, and teach them coping, resilience, goal setting, drug resistance skills in the schools, and also having the dollars available to put on town halls and educate parents, and have things such as YMCAs, different boxing nonprofit agencies, different sporting programs. When you look at Parks and Recs programs, city pools, those types of things are all protective factors. If we don't have those, we turn into Flint, Michigan, where the youth have nothing to turn to.
And then we get the same cycle of adults instead of better adults who are actually contributing to society and not falling into that from teen to adult, or even something that they experienced as a teen.
Well, and again, is it not necessary? So some of them are contributing to society, right? They're functional in their jobs, but they still struggle with an opioid use disorder, and then one day they don't come to work because...
Well, functional even for themselves, though, because that's all that's on their mind. They're not worried about the relationships that they're building with a significant other or friends or family. They're not worried about food. They're not worried about water. They're functioning to the point where they're killing themselves.
Right.
Just slowly.
Right. And you know, when you talk about the impacts, the opioid epidemic, the overdose epidemic affects everybody. So obviously directly it affects family members, friends, employers. Indirectly, it affects the entire community. Again, we look at the cost to society. We are spending $2 trillion a year.
That's almost more than the national debt.
Yeah, I mean, when you look at that, it's incredible that we're spending on this. And again, we don't even know the magnitude of the problem as a society. Yakima, we're trying to get there. We're trying to get that data, because once we have data, we can then identify solutions. And the solutions exist. They're out there.
What else do we have? Is Yakima doing enough? I feel like after speaking with you and after the research that I've done and the people that I've been talking to, I'm a little bit more confident that Yakima's doing more. Because when I first came into this, I was thinking, like, Yakima, this is a big problem in Yakima County. It's a big problem in the state. And what's kind of Yakima doing? And after you kind of gave me more additional information, I wouldn't say that, okay, is Yakima doing enough? I think Yakima's doing what they can and trying to get better compared to others in the state.
I would say compared to others in the state, Yakima scores higher. But are we doing the best we can? No. And again, it goes back to community involvement.
Right.
Don't turn a blind eye. This is a problem. Don't assume that it's a homeless issue. The majority of those overdosing are housed individuals. Again, this is an adolescent disease. This starts as a child. We as a society have to recognize that and want to do something different. What we're doing isn't working, and we have to invest more in prevention. Prevention works. Evidence-based prevention works, and people have to recognize the difference in non-evidence-based and evidence-based, and it starts with the community. If we don't have community, we will fail, and this crisis will grow.
And then kind of leaving that on law enforcement, on officials, on legislators to make things happen when like you said, the community can get involved. They can get more educated.
Absolutely. And then also our legislators, our community leaders, the mayor, city council members, our commissioners, leaders in their schools. They're leaders for a reason. You know, they naturally take the initiative, and they are self-motivated. But if they really want to be more effective, they could get more involved with community and help lead the helm for this as well. Rather than look at, this is my 9-to-5 job, I'm clocking in and clocking out. If people shifted their mentality and recognized we're in crisis mode, especially within Yakima County, we have different pockets that are worse than others. And so sometimes I feel like the community doesn't understand they're in crisis mode because it's either underreported or there's a lack of understanding, or both.
Or they're leaving it up to those officials to take care of the job.
Right, somebody else is going to do it. It's not my problem. It's all of our problem. And that's where I go back to, don't complain about the problem unless you're willing to get educated and be a part of the solution.
Where are we next? Do you feel like this is an unsolvable problem? Like there's not enough money in the world to kind of solve this?
I believe it's
I don't know if it's something that kind of, this might come out weird. I don't know if this is something that almost needs to be solved or is unsolvable. But the only reason I say that is because we know that the world's not perfect. There's always going to be something, quote unquote, bad going on in the world. So unsolvable, solvable, manageable is what I'd say. Can we make this problem manageable?
Right, so I agree with you. We can't make it go away 100%. But one of the other questions we have to ask ourselves is, the fentanyl epidemic is a North American crisis. It doesn't exist anywhere else in the world. Why does it exist in North America?
It's so sad.
Right, and so we are a target market. Why is that? Is it solvable? Not 100%. Is it manageable? Yes, absolutely. There are many things we can do as a society, and again, I go back to prevention. And of course, prevention, we can't prevent our ways out of this, but dang close. We can't arrest our way out of this, but we do need to bring back laws that are stricter. So right now, we have juveniles that cannot be interviewed by law enforcement without a lawyer present if they get caught with substances or in violating the law. And if they pick up the 1-800 number and call Seattle for a defense lawyer, the defense lawyer says don't talk. Schools and law enforcement individuals know of community members that are youth that are being sent back and they're being sex trafficked and they're participating as drug mules, and there's nothing we can do about it because of our laws. So we also need
Specifically in Washington State.
100%, yes. And there's other states that have lenient laws as well, but yes, that is a problem in Yakima because of Washington state legislation. And again, we can't arrest our way out of it. However, when a juvenile does go into detention, even for a short period of time, they recognize that they're out of that environment and they start to build those relationships with those and they start to talk. And now they have probable cause to now stop that behavior. But without the youth talking to them, they don't have the probable cause to act. And so with proper laws, legislation, that would help. So again, but we can't arrest our way out of it. We also can't treat our way out of it. We don't have a medical detox facility in Yakima County. We need to fund and find funding for a medical detox facility, and that's where somebody
in the state?
Not in Yakima County.
Oh, not in Yakima County.
In Yakima County. And medical detox is where we are slowly taking somebody off of, or microdosing buprenorphine and Suboxone, safely taking them off of that opioid to help them cope with those withdrawal symptoms and those cravings. And then we can effectively transition them to treatment. We don't currently have that in Yakima County right now.
What's the closest facility?
Closest would be Seattle. Would be the most nearby. Yep. And so we are, as part of our sequential intercept map project that Safe Yakima Valley did with Commerce, a state commerce grant, We met with over 60 agencies in the community and said, how can we solve this problem? Where are our strengths and where are our weaknesses? What resources do we have and what gaps exist? And we're just coming down to the finalization of that project at the end of this month. And one of the things that was identified as a top priority and need is medical detox.
Oh, good.
However, we need data in order to say to the state of Washington, hey, we need money. And we didn't have that before the OD map project. So the OD map project was the second prong of that sequential intercept map project so that we could start to gather the data. The third prong is that with drug trafficking and sex trafficking, there's often violent crimes that occur. And so there's a correlation between that. So we actually dove into the violent crime data that exists in Yakima, Benton, Franklin, and Grant County, and that also will be part of the report that we can then send to Commerce and say, do you see now Yakima County leads the state with overdose deaths per 100,000. We have X amount of crime going on. We have sex trafficking. We have drug trafficking. We need money and resources. We also have opioid settlement dollars. I know that our local leaders in terms of the mayor and our commissioners are in current and active talks about what can we do to get a medical detox in Yakima County. The other thing is with taking that OD map data, we can then hopefully get funding to get more DCRs in the community, so designated crisis responders, to team up with trained EMTs that respond to an overdose that can administer MOUDs, so medication for opioid use disorder, buprenorphine and Suboxone, on site when it happens, and then do a warm transfer to something like Ideal Options within 24 hours, and then eventually get them into treatment as a result of that, and get them a primary care physician that will ultimately help them with that prescription. And I relate medication for opioid use disorder is the equivalent of insulin to somebody who's a diabetic. A person may very well need to be on medication for opioid use disorder for the rest of their lives, but they will live a fruitful, productive life as a result of that. So we also need to increase the number of prescribers prescribing it. We need to have warm transfers when somebody's taken to the emergency department. Now they get medication for opioid use disorder. Where do I go now? Well, we need to get you set up with a primary care physician. We also need to get you treatment. So there are communities across the United States that currently have this model and are extremely effective in reducing their number of overdose deaths. And but it takes all of this. But it starts with prevention. Then we have to have investment in harm reduction, so Narcan and medication for opioid use disorder. And then we also have to have treatment and recovery, so medical detox, as well as treatment providers. And throughout that process, we have to include our local law enforcement. So there often is a divide between public safety and public health. We all want the same thing. We just go about it differently, and we have to understand each other's perspective. We can't arrest our way out of the problem. We can't treat our way out of the problem, but we can work together, and we can resolve this problem together.
I don't think I have anything else for you, unless there's a question in the kind of part 5 in the end. I really appreciate you answering multiple questions before I'm even asking it. I really appreciate it. Because I didn't want to keep you too long, and I was like, oh gosh.
Probably the final thoughts.
I only have her for 45 minutes. So if nothing changes, what does Yakima look like in 5 years?
More crime.
A fluctuation?
More crime, more deaths, more youth using. The problem will escalate. If we maintain status quo, if we don't, the problem will escalate. There's no question. As we talked about, if it's not fentanyl, they will substitute it with something else. We have to address the crisis as youth. We have to address the demand.
And then what would you say to lawmakers who still think this isn't urgent?
So I would urge lawmakers to get educated. Why is this a North American problem? Why doesn't it exist across the world? If you go to the World Drug Conference in Vienna, the room gets packed when they talk about the fentanyl crisis because it doesn't exist anywhere else, and so they're fascinated by it. So why is that? So why are we vulnerable in North America, Canada, and the United States? The other thing that I would say is, why are we throwing money at a problem when we haven't even taken the time to identify the magnitude of the problem. We need to track non-fatal overdoses. We are currently underestimating the problem about 6,200%. Even if that was an overestimate, we're underestimating it by no less than 5,000% across the United States. We need something like ODMAP or another tool where we have streamlined reporting and we can quickly identify through hospital databases, State Department of Health databases, the number of fatal and non-fatal overdoses to address it. And then I also would say we need to review our legislative pieces. And we really need to look at, while the intention was good for some of these, not allowing juvenile to talk with law enforcement. Obviously, we don't want juveniles locked up for a long period of time. We also have to look at the benefits of having that person pulled away from their environment that has made them vulnerable, whether they're being sex trafficked, they're participating in drug trafficking, if they're being abused in their current environment. Sometimes having them out of that environment gives law enforcement the probable cause they need to really go to the root cause of the problem and deal with it. So I would say those three things is undercovering why it's a North American problem. We have to identify the true magnitude of the problem, and we have to look at our laws honestly, not partisanized through non-partisan eyes, because the drugs don't care if you're Democrat or Republican. They don't care what religion you are. They don't care what race you are. The drugs don't care. They're coming at you no matter what. And so we have to look through nonpartisan eyes and really scrutinize, honestly, current legislation and what can we do to improve it, to make it better, that our youth aren't becoming vulnerable.
Yeah, and like you said, a lot of the laws are very lenient when it comes to that.
Correct. And again, I sincerely believe they had good intentions. They were worried that many youth were being incarcerated. It's the youth, the brain isn't fully developed, but yet those youth are being abused by their trusted adults in those situations. And so we have to get them out of there and let them know that that behavior isn't okay and get them on the path to help.
And I think my last question, is there anything you wish people would stop saying about addiction or overdose?
The first thing I would say is stop saying substance use disorder is a choice. And I understand why people say it, but again, it goes back to lack of education. Instead of looking at that 35-year-old person that's struggling with substance use disorder, or that homeless person that's on the sidewalk, as an adult, you need to go back and understand that person started as a youth. They started as a child. That was a child who started with alcohol, tobacco, or marijuana, and they didn't understand the risks they were taking at that time. They were just trying to cope with pain, and they didn't have a healthier alternative. So it goes back to educating yourself on what can we do to help our youth and our adolescents, and choosing healthier ways to cope with traumatic experiences, and helping them exposed to healthier choices to deal with those situations. The second thing is stop complaining unless you're willing to be part of the solution. Take the time to get educated. Admittedly, I shared some of these same feelings prior to becoming a preventionist. When I was in banking, I shared some of these same perspectives because it was lack of education. I was not educated. Once I saw the data and the statistics and the numbers, it was a big eye-opening experience for me. And I became very passionate about it, wanted to make a true difference in society. And the other thing is prevention works. Oftentimes people say, oh, DARE, they again go back to DARE. Prevention doesn't work. Prevention is the most effective, the data supports it, in addressing the opioid use disorder, in alcoholism, in all of them, again, because we're addressing it where it's beginning. We're dealing with the demand side. And so understanding that and immersing yourself in how you can be a contributor in community in our prevention efforts.
Addiction is a disease, not a choice.
Right. Yes, it's a brain disease, and the data supports that.
You are all set for me. I apologize that it ran.
That's okay. This is important. I know. I'm glad. And if you need anything, if you're like, ooh, this just doesn't flow right, you need me to re-record something, let me know.
No,
I'll try to remember my own.
It was amazing. I feel a lot better now about my understanding and how I kind of want to go about everything. So I really appreciate it.
No, thank you guys. I think it's awesome that, you could have just said, when you took that phone call. This lady's lost her mind, she's crazy pants, you know, but the fact that you want to do something about it speaks volumes to the KIMA team.